Cortisone side effects may be worse than you think. You might have been prescribed cortisone and think, oh, this is great. It's going to solve my problems. But you need to know certain things about the side effects. Hi, I'm Dr. Megan, the prednisone pharmacist, and I'm here to help you understand what the side effects of cortisone are so that you can make the decision of how to proceed with your healthcare in the best way possible. First, I'll talk about what cortisone is, what damage it does, and finally, what you can do about it. So, what is cortisone? Cortisone is kind of a general term for a bunch of medications that mimic our body's naturally occurring hormone cortisol. And so it used to be the actual drug name, and now people still refer to other drugs as cortisone when they're not actually cortisone. Because cortisone itself had so many side effects, and these other drugs that are similar to it are more targeted, and they're created by the scientists, and they go straight to the place and have a little bit fewer side effects. So cortisone, as the cortisol mimicking drug, is helpful for things like inflammation. So if you have shoulder pain or hip pain or knee pain or autoimmune conditions such as rheumatoid arthritis, or you might have a rash like eczema, and you might need a cortisone cream. So that's what it's used for. It helps turn down the body's inflammatory and immune system pathways. And it can do amazing things. It can truly help people in so many ways. I know that the cortisone mimicker I took, called prednisone, literally saved my life. I would not be here today without it. And cortisone injections, whether it's in the spine or right into a joint, can be very helpful, but can come at a cost. So I want you to know what those costs are, because hopefully your doctor explained what the benefits were, what the pros of doing this were, because it can be miraculous. I know a family member of mine has arthritis in the hip and cannot walk without having an injection of cortisone into the hip joint. Otherwise, this family member would have to have a complete hip replacement and does not want to undergo surgery. And so cortisone is allowing this family member to continue to walk and do so with less pain. So it can be amazing. However, this family member has undergone many side effects from this injection, from weight gain in the face, called moon face, weight gain in the hips, the belly area, water retention in the feet area, and other things. Theoretically, an injection should have minimal side effects in comparison if you were to take prednisone, the pill. This is another form of cortisol mimicker, or cortisone. And the pill scatters the molecules throughout your whole body. And so you get side effects throughout your whole body. But an injection should theoretically stay where it's supposed to be. A cortisone injection in the eyeball or in the shoulder or something like that should keep most of the benefits and the risks to that location. But it's possible, spread throughout the body. The doctors who prescribe these medications the most talk about how side effects like osteoporosis are not only caused by pills, but can be caused by injections, by creams, by inhalers. It's less likely. It's much less likely, but it's still possible. So what are other side effects? Osteoporosis is a possibility. Infections, because like I mentioned in the beginning, cortisone is turning down your body's immune system. And that's one of the ways it's helping. And so you're more likely to have an infection, not just an infection like pneumonia, but also an infection at the site of injection, if that's how you got your cortisone. So what are the long-term side effects of cortisone? Well, in general, cortisone and cortisol and prednisone and other steroids can cause osteoporosis, muscle loss, and fat redistribution. Things like the moon face and belly weight gain. It can also lead to heart disease and diabetes, the blood sugar changes that lead to diabetes. In addition, the way cortisol works is it's created by the adrenal gland on top of your kidneys. And when you have a lot of cortisol in your system, it turns off your ability to make cortisol. So that can also change. It's called adrenal gland suppression or adrenal issues or being hypoadrenal. Those things can all be possible side effects long term. And then what are the side effects specific to an injection of cortisone itself? So at the injection site, I've already mentioned that there can be infections at the injection site. But in addition, there can also be skin thinning because the way this works is it can break down the cartilage and the collagen, all of those proteins and things that strengthen your skin to make it strong and thick as it's supposed to be. They can kind of loosen and thin out. And so not only that, but cartilage in the joint can also get thin and damaged. It can be just a loss of cartilage. And that's generally not something that you want in a joint because that can lead to further damage. So essentially how cortisol works is it's stealing the good stuff and helping you survive at this moment. And so that's why doctors are going to limit you to a certain number of injections per year or per lifetime because the damage it can cause is cumulative. That when it's stealing from your bones and your cartilage and your collagen and your muscle, it doesn't just come back. Like the bone loss is irreversible. So you might have, like my family member, bone on bone joint issues, but then the bone around it is being depleted, getting osteoporosis. So which is worse, breaking that bone from the bone loss because you've had too many injections or having the bone on bone arthritis pain? It's a really tough situation. And that's why the doctors are like, well, I can give you this, but we're making a deal with the devil here. It's temporary. It's not a permanent solution because it can cause permanent damage. And it's not just those, it's also the tendons. The tendons can also have damage as well. So when it comes to cortisone and any other steroid treatment, the question is always whether the benefits outweigh the risks. And I hope your doctor has shared all of those benefits with you. And now you know some of the risks that you might be dealing with when it comes to cortisone side effects. And if you want to know how to minimize those side effects, then you should download my Prednisone Checklist. Now, prednisone isn't cortisone, but is kind of in the class of cortisone drugs. And so what is true about cortisone is true about prednisone. And so this Prednisone Checklist includes all of the things that you need to do to counteract the side effects, to minimize those risks for you, to know exactly how to minimize the bone loss, the muscle loss, the damage to the eyes, and other things. So you just download this checklist and it'll tell you exactly what to do. You can print it off, you can share it with your doctor, whatever you want, so that you can feel like yourself again while having treatment with cortisone. Signing off as Dr. Megan, your prednisone pharmacist.